Today we're going to talk about denial, the river in Egypt. Wait, 1 second, what? What? No, oh, I'm sorry. Denial, different one. This time, when your health insurance doesn't cover a service. If you work in human resources or as a benefit consultant, employees probably reached out to you because they got a letter or an explanation of benefit or a bill because a service was denied. And it can be large. Today, we're going to talk about what you can do about it, how you can help that employee assess what's going on, and take the right next steps to hopefully resolve the issue. Hi, my name's John. I'm your healthcare hacker and a maker of a bad pun occasionally. Before we get started, please take a minute, like this video, subscribe to Athos Health on your favorite social media platform. By doing that, you help us get our message out. We're here to try to help as many people as possible navigate the U.S. healthcare system. Denials are probably the most common reason why I hear from benefit consultants and human resource professionals. They call me up because an employee is facing an issue that's usually very significant dollars and potentially incredibly scary. The employee doesn't know what to do. Well, today, I'm going to give you a couple tips about how to help that employee assess what's going on, figure out if they should be concerned or not, and then kind of what are the next immediate steps they need to take to hopefully get out in front of the issue. Well, the first question you need to ask, and probably the most important, is was the service that was denied, was it in-network or out-of-network provider? Let's start with if it was an in-network provider. Then you need to ask the employee, what does their explanation of benefit say? Most importantly, does it show an amount in a non-covered service that shows it as the employee's responsibility? If it doesn't, and I've had a lot of people come to me with issues in this case where something was denied, they got a letter in the mail, but the explanation of benefit shows it's not covered, but that balance doesn't sit with the employee, they probably don't need to worry. You see, with in-network providers, by contract, for many services that are denied, the provider is responsible. And per their contract, they can't bill the employee or member. So I'd have the employee watch it, make sure they don't get a bill, but in most cases they won't, and they really don't need to lose much sleep about this type of issue. Again, it shows them not having any balance, and it was an in-network doctor. Now let's talk about if it's an in-network provider, but on the explanation of benefit, that non-covered amount has a value, and it shows it as the employee's responsibility. This is where you need to give the employee some really crisp guidance. What I recommend is first to make sure they understand why it was denied. You see, there's certain reasons why an in-network provider can get denied a service and the employee can be responsible. If it's something like cosmetic surgery, if it's something like you exceeded a number of visits for like therapy, it's like a benefit issue, then even if you're in-network, the employee can get stuck with a bill. So I would have them call the health plan and figure out exactly why that service was denied and if they are responsible. If it shows an explanation of benefit, the health plan will probably say they're responsible. Then I'd call the provider. The provider most often wants to work with you. They want to get paid for their service, and they know the best chance of getting paid for their service is through the health plan. So I'd work with that provider or tell the employee to work with that provider and to team together to write an appeal. The provider should know how to do it, but they may need you to sign something, or the employee to sign something authorizing them to do it. So have them work together with that provider, and more times than not, that will straighten it out. And if nothing else, if it continues to be denied, it gives you the employee some leverage to talk to the provider about maybe getting a discount on the service because they've been so helpful in trying to get it covered. Well, now let's move on to out-of-network. This is the one that's scary and probably need to be most concerned about. If that employee went to an out-of-network provider, they could get stuck with a large bill. You see, by definition, an out-of-network provider doesn't have a contract with the health plan. And therefore, they can bill the member the full charges if something's denied and bill that employee. The employee can get stuck with a very large bill and they have almost no protection because it's out of network. In this case, they need to call their health plan and figure out exactly why the service was denied. Ask for the medical policy number. Figure out exactly the reason why. And again, once they know that, call the provider and figure out what they could do to help. Again, whether it's appealing the service is probably your most common outcome. And there can be multiple appeals, but exhaust all those. Because if you don't, that provider can stick that employee with a large bill. Well, those were just a couple of quick hitter tips about what you can do to help that employee navigate a denied claim. If you have any questions or comments, please leave them in the description below and we'll try to address them in a future healthcare hack. And to learn more about how Athos Health can help you, please visit our website at athoshealth.com. And as always, make sure you get the facts by joining me in the next episode of Healthcare Hacks.